seconds are there. You just please check the seconds, but how many times I'm manipulating. Start now. 3, 2, 1. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 40, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 51, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So the neck, I just hold the needle, one needle, the another needle, you just activate, then you just accordingly, you just plan it, you stimulate to all the points. You need to hold it for a few seconds. Now I just holding to the, now you are holding the needle with the fingers, the another needle you are just activating with the pen, that indicating both the needles are active. B area, this is the A area, then another area may be known as the B area. We just cover from the 1 centimeter lateral to this region. Then further I just applied the 1 point here. First we try to find out this line to be known as the anterior hairline. This is the anterior posterior midline. We have to register in our mind where the bindi is existing here. From the bindi to the posterior hairline.
To listen your voice properly.
Remember, this is the first line to be known as the anterior posterior midline. And in this, we try to recognize the location where exactly the points are located now. So now the first, as per the Yamamoto new scalp acupuncture, we just apply 1 centimeter lateral. 1 centimeter lateral to the, now you can see this is a scale we do have. In that scale, this scale is related to the 15 centimeter. Now we try to select the 1 centimeter lateral. We need not to measure. Initially, we try to find out where exactly the points are located. Now you can see 1 centimeter lateral to the 1 centimeter lateral to the anterior posterior midline. Now we just applied for the head and neck related disorder this line. Now treat for the all the head related disorders. We just applied, the point is upward direction. Then the another needle we just apply for the neck related conditions. We just apply to the downwards direction, but this to be known as a there is the 2 inches above. The whole one shun needle is equivalent to the 2.5 centimeter length, but in that case the 2 centimeter above, the needle has gone upward direction on the posterior, towards the hairline, but that indicating that this is treatable for the head related disorders. Further to the downwards direction is related to the neck related C1 to C8 now included here. Now all the head related is indicating anything, the cerebrum, cerebellum, basal ganglia, or any the pain related conditions, or maybe something connected to the anxiety, depression, insomnia, and further stress related condition, anything, because the head is governed by the all the central nervous system, especially brain function. The brain function need to be activated. As a supplementary, as a supportive, we just apply the one needle to the upward direction. That will be really helpful, but we just apply to the upward direction. The second needle we just applied for the what condition? All the neck related conditions. This is the another point as well. Now we just apply the another point, so which we call as a, there is another point to be known as a B area. This is the A area. Then another area to be known as a B area. We just cover from the 1 centimeter lateral to this region. Then further I just applied the 1 point here, the posterior and then inferior. Both the things I just covered this nearly 2.5 to 3 centimeter. But here is, this will be really helpful to treat for the what condition? For especially for the neck related condition. Especially for the neck related condition. Again, it is the 2.5 centimeter lateral to this line to be known as a 2.5 centimeter. Now let me see, we try to select the point from here. There is a 2.5 centimeter. This is a 0, 2.5 centimeter. This line is treatable for the upper extremities and shoulder related disorders, but this point is treatable like this, upward and towards the nose. This treatable towards the nose of the bridge is advisable, but this is a straight lines and this is as a slightly oblique line towards the nose is advisable to treat for the shoulder girdle are the upper extremities. Upper extremities including the shoulder, clavicle and scapula and humerus, radius and ulna, and all the carpal bones. How many bones are existing? Totally 30 bones known as the upper extremities, treatable for the all the shoulder related conditions. But now there is as a summary wise these points, but whenever having the cervical pain and then shoulder pain together, you just apply, because neck also reason to cause the shoulder pain and shoulder pain itself also reason to cause. So therefore you just apply the B area, along with that you just apply the C area as well. Now you can recognize this as a and this is as a B, and this area to be known as a C area, this area to be known as a C area. So Yamamoto, it says it is really useful to treat for the head and neck related disorders. Now once completed this, now let me see, there is the brain area, where the brain and then cerebrum, cerebellum, basal ganglia, where it is existing. So now let me see, there is a area called as a, now this is as a from here is the 2 centimeter, 2 centimeter above from the anterior hairline, 2 centimeter above from the anterior. This not the anterior hairline, don't measure from here, but from here to here, this to be known as a anterior hairline. Then don't measure like this also okay. Then again from here to here, divided into 3 parts, 1 part, 2 segment, 3rd segment, right? Then from the anterior hairline, then 2 centimeter proximal to this region, 2 centimeter proximal from the 1 centimeter lateral, 1 centimeter lateral, then again it is the 2 centimeter proximal to this region. This to be treatable for the cerebrum, cerebellum. I just apply as a integrated. Cerebrum, cerebellum. Where is cerebrum? This the part is cerebrum, this part is cerebellum. So biggest part is cerebrum, lowest part is cerebellum. So both the conditions we can treat. Then further we just apply on the another side also, same points you just apply, and the central point to be known as a basal ganglia. The from here exactly the basal ganglia you can apply here. This called as a Shenting and then Shangxiang. So these both the points are good point to treat for the basal ganglia, but cerebrum, cerebellum, basal ganglia, the whole brain is covered by activating these points. Then any head related disorders we need to focus, because lot of numerous reason to cause the related head related conditions, because the neuron related problem, glial cells having the problem, or the rejuvenation is not taken place, or maybe it is a damage, trauma, injury, the brain, blood brain barrier, or anything is the trauma, or maybe paralysis, hemiplegia, paraplegia, quadriplegia, anything is the brain related condition, or the today the emotional related problem, they do have anxiety, depression. In that condition also we just apply this point, but this is as a supplementary point to treat for the cerebrum, cerebellum related disorders. But still we need to find out the core problem, what is the etiology, pathogenesis to cause this problem. We try to analyze, because generally we just apply the needle, the patient will be all right, obviously if the Almighty wills, and definitely she will be all right. So however, we have the try to understand what could be the reason to cause this problem, that accordingly we need to focus and treat. But we do have the laboratory investigations, or maybe EEG and other functional MRI or the MRI CT scan. We try to find out the etiology and then try to focus accordingly. That would be better. But still patient feel all the MRI is normal and CT scan is normal, but still the patient having the pain on my head region, either it is anywhere in the body, temporal or occipital region. So that time you just apply this point, will be you are giving the command to the cerebrum. So please you just activate wherever you have the lacuna and try to increase and elicit the chi which is required to blood flow to that particular region. If the blood flow is good, sodium and potassium ions are circulating very well in the brain, obviously that time the circulation also good. So if that circulation is good, then the alpha waves, delta waves, gamma waves, theta waves. So these are the waves also will be circulate in the brain system will be good, so that the patient sleeps also well. So once the sleeping to be taken place, the cerebral cortex of the brain along with that is the CSF, cerebrospinal fluid, will cool down. Once will cool down, then definitely the patient feel the stress free and then pain also free for the any kind of the cluster headache or the migraine related headache or the neurological headache or the temporal headache, occipital headache, yang ming headache or the tai yang headache. So many different types of the headache that also to be regulated by activating. These are the some of the points. But however, you just correlating cervical headache is there, cervical pain may cause the pain, or the cervical pain is there, vertebral artery get affected, that causes the pain on the brain because the basilar artery also will be affected. But still there are the numerous arteries which is called as a middle cerebral artery and the posterior communicating artery, anterior communicating artery, or the middle cerebral artery. These are the few arteries which causing the problem in the brain. So that time that arteries to be regulated by activating this point. Sir, once we applied, then that's quite enough, but obviously may not be enough. So you just use it as a stimulation to that particular region is really essential. Now I am just using as my hand manual stimulation I am using for the 200 times per minute is advisable. If anyone is the seconds are there, you just please check the seconds, but how many times I am manipulating, and accordingly you just plan it to stimulate for a minute or 2 or 3 minutes. Advisable to stimulate strongly this point. Now cross check this. Start now. 3, 2, 1. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 40, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 51, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So in 1 minute at least we can do it as 100 times. That would be really better to stimulate that area. Now I just applied the needle. Okay. But maybe you feel that is it possible to do that, then you just take the support of the stimulation. This called as a acupuncture electrical pen or the electronics pen. So this to stimulate the acupressure points or stimulate the acupuncture point as well. But the super simple way you will get in the Amazon, and definitely you can use the frequency, the density you can increase 1 to 9 is there. 9 is the maximum potential, but you can start up with the minimum potential. The beginning you need to start from the 0, 1. So you start from the 1 because the females, but they'll get very sensitiveness to get some kind of the pain. Here you are applying as a 2 I started, 1, let me start 1. It's bearable. Then I just stimulate to the another point. Then further I just touches to the some other point. I am holding to the neck, or I just hold the needle, one needle, the another needle you just activate. Then you just accordingly you just plan it, you stimulate to all the points. You need to hold it for a few seconds. Now I just holding to the, now you are holding the needle with the fingers, the another needle you are just activating with the pen, that indicating both the needles are activating at a time. So therefore you just touch and then activate this point, touch and then activate this point, touch and then activate to this point. But you too get the vibration, your hand also get the vibration, but you need not to worry. So timely you have that, and then after that you may not get any kind of the problem. So hopefully, really is it bothering you, Shilpa, or that manual stimulation? How much pain you got
Manual
it?
stimulation, nothing at all. I felt some stimulation, but when you hold the needle and then give the stimulation, the pain is less.
Okay, with the pen, you
With the
mean to
pen,
say?
when holding one needle,
Yeah.
the pain is less, but just with holding the pen, a slight mild
Elevating,
pain.
yeah, elevating that. But however, now you just see this kind of the stimulation to be taken place. Now this is called as a Yamamoto's News A, B, C area, A, B, C area. But still there are the another some of the points are existing here. But further we will proceed for the D area, and then further we'll proceed for the G area, and then we'll proceed for the international standard area to be known as a D zone. Yeah, D zone. From here to here we just activate the point. So we just activate the point from here to here. So this area to be known as a zone called as a D zone. Right, this is the D zone, D1. That means the lumbar 1, 2, 3, 4, 5. So lumbar zone can be treatable for the low back pain, and then sciatica also treatable by activating the another point called as a this as a front of the ear. You can find here from the where exactly gallbladder 7, from the superior to the gallbladder 7 and bring down to the downwards direction. So this area to be known as a sacrum 1, 2, 3, 4, 5 and then coccyx region collectively to be treatable this point. Now the patient having the pain, you just apply the perpendicular, or you can apply this direction, or you can apply in the cross direction, but all the directions is applicable whichever the patient feel comfortable or you feel comfortable for the insertion. Definitely you can activate this point for to treat for the low back pain and also sciatica related disorders as well. But you can use it, make sure the problem is on the left side sciatica, treat on the left side only, but if the right side sciatica, treat on the right side. And now this I told you, the pain is on the neck pain on the right side, you just use the left side pain, left side only you can use it. But whereas in opposite in the Jio-Shanpa method, but this method is useful to treat on the same side. So now we'll see about the G spot, where exactly to treat for the knee pain related conditions. So we just apply the points where exactly here is you can find out the gallbladder 12 region. The gallbladder 12, do you know there is a DU 15, then UB 10, then gallbladder 20, then is the gallbladder 12. Then the gallbladder 12 region, just below to the gallbladder 12 region, 3 needle you just apply. You just apply the one more needle here exactly on this region. This is the lateral knee pain, this is the anterior knee pain, and this is as a medial side of the knee pain. But there are the 3 types of the knee pains are there. For all the 3 types of the pain can be treatable. Each is 1 centimeter away from the each point, but this will be really helpful to treat for the knee pain. This also to be known as a G spot as well. So now as per the Yamamoto we have seen, but this region, entire region is treatable for all the internal organ as well. So all the internal organs are existing over this region, but that's later we will see that step by step how need to be done.